Good evening, ladies. How's it going? Welcome to Wellness Wednesday. I'm glad that you've made it. We're going to let anyone else that wants to jump on. Make sure, also, let's make sure you can hear me and see me okay. If you can, give me a quick thumbs up. There was a definite lag earlier as I was watching the live. So, okay, I think we are good to go. I will say my disclaimer while we're waiting for anyone else who wants to join us. First of all, anything that I say here tonight during this Wellness Wednesday is health information and is not health advice. Do not stop taking or start taking or change the way you are taking any of your medications. If you feel like you need to, please first consult with your prescribing practitioner so that they can help you make the appropriate adjustments. And by attending Wellness Wednesday, this does not establish a doctor-patient relationship. So uh, tonight's topic is something that has come up numerous times over the past week or two as I've reviewed patient labs and gone through histories um, and it's not just women. Some men do get this. I was talking with a gentleman as well who has this pretty badly. But it's generally definitely more common in women. There's like a 90 to 10%, 90% to 10% sort of distribution with this. We're talking about fibromyalgia. Okay. This is this is not an old diagnosis, but it's certainly something that we've, as humans, been dealing with for a long time. The symptoms. Let me first remind you, ladies, about symptoms. Symptoms are your body's way of letting you know, communicating with you that something inside is not working just right. Something inside is imbalanced, something is wrong, and pain and sleeping issues and um, different even different sensations that sometimes people get, physical sensations like tingling, numbness. These are all your body's way of telling you something is going on. Even cognitive issues, which are very common with this. This goes back to the 1800s, though. Doctors have been trying to describe this thinking, calling it first, fibrositis, and sort of indicating that there's some kind of, with this itis involved, some kind of inflammation of the tissues, the fiber, of our bodies, and just trying to pinpoint this. Later research really began questioning whether inflammation was really a big part of this at all. Then in the 60s, they started noticing, well, there's a lot of tender points being associated with this and sleep disturbances that people were complaining about in together. They were complaining about these symptoms kind of all together. You know, in medicine, they do a really good job of clumping um, symptoms together and then giving that a name, right? Not long ago, I did a Wellness Wednesday on chronic fatigue syndrome, where, this is characterized by profound fatigue, non-restorative sleep, cognitive issues, pain. Well, doesn't that kind of sound like this? Because these are very similar symptoms and there's a big overlap. So the tender points became kind of part of the distinguishing factors for fibromyalgia. This wasn't called fibromyalgia really until like 1990, and it became an official recognized diagnosis, medical diagnosis in 1990. And it included having at least 11, up to 18, even, excuse me, at least 11 of 18 possible tender points. Tender points meaning when you're touched in various areas like along the spine and the neck and low back and so forth, different areas, hips, where it was just ultra tender. Okay. Um, And then, because there were such, I don't know, more and more people were describing not only that, but just chronic pain and chronic sleeping issues and cognitive issues that they adjusted the criteria once again, and they took away the tender points, and I mean, it was all very, and a lot of you have been around long enough and have dealt with this pain, this body pain, like whole body, generalized, widespread, non-inflammatory pain, and for so many years. I know a lot of you have had this. Um, the diagnosis now requires you to have like generalized pain in at least four of five body regions. Okay, so it has to be widespread, chronic, at least like at least 3 months in duration. And, it's just, where you have an amplified pain signaling, which they've even been able to show more recently with neuroimaging. Okay, so somehow they've correlated some of the findings they've seen on spinal MRIs, and to say, yep, here's the diagnosis. You've met criteria. Congratulations. Here's your diagnosis. And then what do? Well, they give you a lot of medications, muscle relaxers, anti-inflammatories. I mean, the drill. They give you these symptom band-aids. Okay, and they just call it. It's just fibromyalgia is just a name for this constellation of symptoms. So fibro meaning tissue, myalgia meaning pain, muscle pain, however, whatever you want to call it. It's just a name that they're giving you. It doesn't tell you what's causing it. And so here we're stuck with, you know, some diagnosis now on your chart. Well, great. You merit some sort of treatment, but does it help? Are you free of this pain? Are you getting somewhere with this? Um, or are you just kind of seeing the same doctors again and again about this and expecting different results? You know what that's called, right? Um, so what we really need to understand, and I go through that history just to kind of give you an idea that, you know, we're yes, we're searching for some way to describe it, some way to diagnose it, because that's what we learn in medical school as doctors, is how to find the diagnosis so that we can apply, the right treatment. Um, I mean, it's controversial too. I mean, I think you'd recognize this. I mean, it was some of you who have had this for a long time have, you may know that it was dismissed as a psychosomatic kind of problem, meaning you're kind of making it up. It's all in your head. But then, like I said, it became more legitimate when we started to see there was actually some neuroimaging that could find something. Anyway, we've been kind of all over the map with this. And certainly we humans have been dealing with pain, chronic generalized pain, for a long, long time. Again, dating back to the 1800s. We've been trying to analyze this and identify it. But really it comes down to finding the root cause is going to be critical, right? It's going to be absolutely critical. So, um, yes, these symptoms do overlap with chronic fatigue syndrome, with even mycotoxin exposure. Those of you who attended the master class and were able to watch the bonus video on mycotoxicity or biotoxins, right? Um, there's a big overlap. All those symptoms that you were able to see that can be associated with mycotoxin exposure, mold toxin exposure, there are many. I mean, there was a whole slide, like 3 columns of symptoms for you to look at. And you only have to have really 7, right, to diagnose whether, or at least look deeper at this, find if this is due to mycotoxin exposures. Um, so, of course, as these symptoms overlap so much, comprehensive testing is absolutely vital to be able to find out what the root causes are for these symptoms. It doesn't help to just give it a name. It doesn't validate you in any way, shape, or form. I mean, maybe in a way, okay, sorry, maybe it does a little bit. Like, yes, something, they have a name for what I have. I'm not crazy. No, you're not crazy. But there are symptoms caused by things going on under the surface that are trying to let you know that, yeah, something is wrong. You're not making these symptoms up. Um, so, comprehensive testing is absolutely necessary to find the root causes for these symptoms so that you can actually start to deal with these and correcting them and feeling better, right? That's what we're talking about. So, from a functional medicine perspective, let's talk about this. So, if you have muscle pain, if you have, you know, any sort of, cognitive issues, if you have sleeping issues because of the pain, it's sometimes bad enough to wake you, to cause you to sleep less soundly, right? That's why we get the sleep disturbances. But what's causing those? What's causing this to flare up, if you will? This these overlap. It's well known to a lot of us nowadays that it now seems to have an autoimmune component as well. So we're saying that the immune system then may have an impact on these symptoms, causing this pain, causing this soreness, causing this tenderness, causing these cognitive issues that tend to I mean, wouldn't it be kind of hard to focus on something if you're in pain all the time? If you have soreness all the time, wouldn't it be kind of hard to focus? Just from a common sense perspective, wouldn't it be kind of hard to remember things if you can't focus? Wouldn't it be hard to, wouldn't it be easy? Wouldn't it be easy to get distracted easily? Okay, if you are dealing with pain, right? And then you wonder why you don't remember what your spouse just said to you, what your kids just asked you. Like, is it, I know you women are amazing multitaskers, right? At least you say you are. um I, I believe you for the most part, but my gosh, what happens when you have all this pain and you have this discomfort, and certainly you're losing sleep at night because of it, and so you're tired during the day? Aren't you going to have trouble focusing and coming to the table 100% for your kids, for your husbands, spouses, whoever, your significant others, whoever that might be? Aren't you going to have trouble really participating, being present 100% of the time? So it really begs the question, what is causing this so that we can get to the bottom of it? So functionally, what is the cause? So there's a couple of different things to think about here. We talked about toxins, mycotoxins in that video. So if you are dealing with toxins, if you have a toxic load that is sort of hijacking your body's energy production, energy system, producing system, then you're going to struggle with a lot of different symptoms. Not least of all would be pain. Okay. Wouldn't that be the result of your nerves not getting the appropriate, not making the appropriate energy? The cells that make up your nerve pathways, they're not able to make energy. So they're going to hurt. This is the same idea behind neuropathy, right? If they're not getting, those nerve cells are not getting oxygen, if they're not getting nutrients, B vitamins, if they're not getting, um, if they're not getting magnesium, any of these trace minerals that are so important for your mitochondria and your nerve cells to make energy, then aren't they going to let you know? Aren't they going to, in some way, shape, or form, let you know that something's wrong? And so, yes, this is what happens. And your muscles, they've got these nerve endings going to the muscles, lots of sensory nerves going to your muscles as well. And so, I mean, a lot of you have had muscle cramps before. I mean, they hurt like hell, right? Sorry. They hurt. And it's like, what's causing that? All right, so deficiencies. What about electrolytes? Wouldn't wouldn't you feel it if you had imbalanced electrolytes, perhaps? Yeah, probably would in some way. Um, I mean, it's not everybody does, but if you have this pain, wouldn't it be worth getting the information, getting the testing to show what is going on underneath the surface to cause these imbalances? Okay. Um, all right. So, so toxins, when they're there in your body, and you may have the genetics that you can't clear these toxins out, um, they're going to hijack your energy production. And then you can't make energy, and then your cells, your nerves are going to let you know. Okay, that's one scenario. What about infections? Hidden infections, wouldn't they sometimes cause pain? Yeah. So viruses can often do this. Parasites, perhaps, when they are getting the better of your nerve cells, they're going to let you know. Um, certainly, you could have bacterial infections that are underneath the surface, but that would be kind of less common, causing this fibromyalgia kind of issue. What about leaky gut? Now, we've talked a lot about leaky gut. I've done a couple Wellness Wednesdays on leaky gut, but let's kind of dive into this a little more. So when you don't digest things very well because of other problems, because of low thyroid, because of stomach acid issues, when you don't make enough stomach acid, usually because of low thyroid or maybe blood sugar problems, then when you don't make enough stomach acid, you don't digest your protein very well. Those proteins that you eat um, go into your intestines and cause inflammation of the intestinal lining. This ultimately causes the lining to kind of split. It's inflamed, the cells shrink, shrivel up, they separate, causing little gaps in between the lining cells of your intestines. So then you have these undigested particles, maybe even other, microorganisms leak into the bloodstream. And right under that layer of cells lining the intestines are tissue. It's nervous, excuse me, it's immune system tissue. It's immune regulating tissue. Okay. It's called GALT, gastrointestinal associated lymphatic tissue. In this GALT, this is where 80% of your antibodies are produced. Antibodies are what your immune system produces to tag the problems that your immune system sees, to protect you. And so this is where we're thinking, okay, well, there's an autoimmune component to this. Okay. And so you have all these antibodies that are made right there under the surface. You're eating this food and you think it's good for you, even, healthy diet, and maybe you're just not digesting it. It's causing leaky gut, right? This is causing and the immune tissue under the surface of your lining of the intestines to immediately start producing, antibodies and complexing with those particles. Say those undigested proteins. You've got white blood cells that are going to grab onto those and complex with those undigested particles, with bacteria, maybe with the yeast that leaks through, parasites. And those immune complexes then circulate through your system. They first go through, a lot of times, your liver. but they can stop on their way and get deposited into your muscles, okay? Into your joints. They go into the lungs, into your brain. Do you see where I'm going with this? You can have all these sort of different symptoms, not just fibromyalgia, but this leads to things like asthma and allergies because they go to your mucous membranes and they have to then deal with those tissues have to deal with those immune complexes. Okay. And this becomes an immune system issue, right? When this is perpetuated long enough, this can cause other things like MCAS, multiple, not multiple, mast cell activation syndrome. Sorry. um, Multiple issues. Yeah. But MCAS is mast cell activation syndrome. Okay. So that's when your histamine producing cells kind of go crazy because you have these complexes that are in your tissues now causing problems. This can cause pain. This definitely can cause that fibromyalgia. Okay. Um, so leaky gut. This is something that's becoming better understood, but it's still not well characterized. Medicine is almost always 20, 30 years away from, really establishing, uh, really treating something or accepting something. That's better terminology, accepting something as mainstream, and especially if there's a medication to treat it. I mean, it took a long time for fibromyalgia to even get to where it could be a medically established diagnosis. Just in 1990. It hasn't been that long. So, but it took a long time for it to get that way. So, deficiencies. Can you have deficiencies that cause this? What about lactic acid buildup? Some of you have it so bad that it causes this fibromyalgia. So there's lots of different causes, as you can tell. Magnesium deficiencies, um, certainly CoQ10 deficiencies. Those of you who have tried taking statins and develop muscle aches and these sorts of things that could easily be misconstrued, misdiagnosed as fibromyalgia, where you're actually just missing CoQ10, where your mitochondria in your muscles and nerves cannot make energy for those cells and tissues. So you get this profound soreness and achiness. And it goes on long enough, again, over 3 months, develop these tender points and so forth. Then they give you this diagnosis of fibromyalgia. Well, there you go. Problem solved. No, problem not solved. Because then you have to take medications if they give them to you, um, or suffer. So my point in sharing this with you about fibromyalgia this time tonight uh, is to illustrate a key point that I know a lot of you suffer with this, and you have no clue what's causing it. You're just dealing with it, and you're taking the medications like diligent patients, and some of you it is helping, but for so many of you it's not because you haven't ever gotten to the root cause. So when I talk about comprehensive testing, it's so important to finally get the answers, the underlying root causes figured out so that we can address these problems and actually help you to get results. All right. So um, I'm going to take I'll take a couple questions. I know we're into this about 20 minutes, and that's okay for me tonight, if it's okay with you. But I will take a couple of questions and see what we can do with those. So, okay. Um, I read a book by a doctor that said it is the kidney not being able to secrete phosphate, which is making you toxic and triggers nerve receptors. Yeah, I mean, it could be that too. It could be that, when you have kidney damage to the point where you develop, it's called hyperphosphatemia. Okay. That can certainly lead to some pains like this too, but it's not just that. My point is there are so many different causes, which I didn't certainly cover all of them. I'm um, some that I, frankly, just not thinking about. But yeah, you bring that up, and that's a good point. Um, it just goes to show you that you've got to get these tests. You've got to figure out what is going on. Do you have kidney disease? Is there, kidneys that so the problem with this is it's not, so the kidneys would not filter it out, right? It wouldn't filter out uh, the filter enough phosphorus into, the urine. Okay, it just maintains it in the bloodstream, and that's then you get this hyperphosphatemia, and that certainly can trigger certain things. What about taking the Shingrix shots? I've had shingles before. I think the term is Shingrix. Anyway, sorry, that's why. um, and I'm not sure that this has um, everything to do with this, but it's, yeah. I mean, when you have these viruses in your system, they're generally, when you get shingles, the herpes virus that causes shingles, the varicella, it congregates in one of the ganglions, one of the nerve bundles down your spine, whatever level it is. And it could be up here, causing, shingles up here, which is really crappy, versus anywhere down, the body. And so, uh, I mean, yeah, I mean, you can avoid getting shingles that way, but it doesn't take the virus away. It doesn't mean you're not going to get shingles. I've had so many people get these shingles shots and still get shingles regardless. So, um, as far as what this has to do with fibromyalgia, I'm not going to say there's a huge correlation, but I guess you asked the question. What can we do for fibro pain? Again, the most important thing you can do is get to the root causes. Treating the pain, it takes a lot of, there's going to be a lot of possible solutions for, for treating the pain. And I hear you. I mean, it's, it can be super bad, and I know you're tired of hurting, but the best thing you can do is uh, get comprehensive testing and start to figure out why you're actually in pain. Because it's, it's again, one thing to have this diagnosis, this label, but it's another thing, ladies, to figure out what's causing it, because there are multiple causes. So that's why I do master classes as well. We're going to be doing, another one in the near future, and you'll need to stay tuned in the group to make sure you um, see the announcement, so that you can attend and figure out how you can get this testing for, how it's going to work for you. And because I explain all that in the class, um, it's it comes down to getting the testing. I can't tell you what to do for your pain right now. I don't know what's going to help it without talking to you and getting information from you. That's really, really important thing to understand right now. But I do hear you that you are in pain and you're tired of it and it sucks. And so uh, this is the first step, getting the testing, right? To figuring this out. Now, the next question is, does Dr. Redd test for MCAS? There's no great test for MCAS, all right? Uh, Mast cell activation syndrome, it's all the testing that we do helps me understand what's going on to cause it for you. Okay, so in that sense, absolutely do I test for it, but Is that what I'm testing for? When I talk about comprehensive testing in the masterclass, you're going to learn all of the markers, learn about all the different markers that I get to test what is going on under the surface to find your root causes. Okay. I know a lot of you want answers right now, but this takes a lot more time to explain than what we have to do tonight. Have to do that. It's just, it takes, uh, truly takes giving a master class about this to give you all the information you need. So be prepared for that. Plan on attending. Um, and yes, it causes chronic hives, right? It can. Okay. Uh, this next this next question. So I have Hashimoto's, hypothyroidism, fibromyalgia, arthritis, colitis, GERD, Sjogren's, asthma. I mean, gee, Jiminy Christmas, the list goes on. I have severe allergies, sleep apnea. I can't take steroids because it causes more vision loss. I'm immunocompromised. What labs do you recommend I take? For you, you must attend the master class. You must learn what testing I get, all right, to test your immune system function, to test you for blood sugar issues, but not just basic blood sugar testing. There's 12 markers in a dysglycemia panel. There's multiple thyroid markers that we must check. We need to see what is causing your immune system with all of these autoimmune problems that you have. The key is finding out what your unique triggers are. And only by doing comprehensive testing are we going to be able to do that. All right. So that is what you will absolutely need to do. The diet that I recommend to decrease inflammation, well, I do cover that. And if I just give you a list of foods to avoid, ladies, you're going to get upset at me. Okay. And you're going to ask me tons more questions that I won't answer here. Okay. I will answer them in the masterclass because that's where I have time to do it and give you the right context. But stay away from sugar. If you can't stay away from sugar, then you're going to continue to deal with the consequences. And pain is often a consequence of just not being able to leave sugar alone. All right. Um, Corn is huge too with this, and there are others. Um, but I will give you that list and talk more about these in the right context. I promise. They're in the next masterclass. Is there anything else that I should be taking to help me? Again, I can't answer that for you, but some people need the right supplements. Some people need magnesium. Some people need extra vitamin D. Their vitamin D levels aren't up there, and you need to get the right form of D with the right cofactors. You need to have a lot of times, the right active B vitamins. But these are just generalized statements. Please don't just run out and get all of this in hopes that it's going to help you because we don't know for sure unless you just, again, this is on you. Okay. I haven't recommended anything. But this is often a problem where you're just missing so many nutrients that you're not getting, trace minerals, the right trace minerals that you're not getting in your food. Um, when you're eating a lot of processed foods, ladies, stop. Don't eat those processed foods. If you're hurting, don't eat processed foods. Don't eat sugar. Okay. Um, and and trust me on this, dairy, get rid of it. And again, I will tell you why in the master class. Okay. Um, I know this is it's so maddening when you deal with this pain and you're given these medications and you're not really getting anywhere with it and you're dependent on these medications, and a lot of you are dependent on narcotic pain medications, and that's not helping the problem. All right. What about Epstein-Barr virus? Does that stay in the system for years and years and cause problems years later? Yes, it certainly can. Yes. Um, Epstein-Barr virus is a member of the herpes virus family, and it will stay in your system for your whole life. And a lot of us have to suppress it. All right. A lot of us have to learn how to suppress it. What causes chronic hives? Well, again, when the mast cells get activated, All right. When you have, in fact, parasites are a good thing to talk about there. Parasites often will cause um, allergies and chronic hives because they being present, if they're, and some people, they really cause more problems than others. But yeah, that's what we have to test for as well. Um, Food sensitivities certainly can cause chronic hives. Um, Obviously food allergies. Can I get blood work done 2 days after stopping biotin that is in my multivitamin? Yes, I would suggest 2 or 3 days. Yep. Yep. That certainly it just affects the test. It doesn't affect your body or how thyroid functions work, but biotin can affect the lab assays, the laboratory tests themselves when they're trying to measure your TSH and sometimes your other uh, hormones like parathyroid hormone and um, even some of your thyroid hormones like your T3 and T4 and binding, thyroid binding globulin if you're getting that tested or yeah, so even some of the thyroid antibody testing can be skewed by taking biotin. So, okay. Uh, what about corn-fed beef? That's the question. Um, so corn-fed beef is going to be much worse for you than grass-fed beef. Yeah, because the corn really enhances the fat in the beef and it turns the fat into omega-6 rich fat rather than omega-3 rich fat, which is good for you. Omega-3 rich fats are good, um, but omega-6 rich fats are not. All right. So, yeah, there's a big difference. A big difference. Is mono also called Epstein-Barr? Mono is caused by Epstein-Barr virus. There are six different strains of 66 strains of Epstein-Barr virus that cause mono. Okay. Does that wrap it up? Ladies, great questions. Um, and I wish I could get a lot more specific with you on a lot of that, but um, stay tuned for the masterclass. Plan on attending that. If you're in pain and want to figure out why, that's a must attend class for you. Okay. Okay, one more. It's best to get fiber from food. Can supplementation help you get 35 grams per day? Um, it is best to get fiber from food. Fiber supplements certainly can help, but they're not necessarily the answer, and some of them are. You have to be very careful about what's added to them. So you don't want to get anything that's got a lot of additives or sugars or sugar substitutes. You just don't want to mess with that kind of stuff for fiber supplements. You're better off getting all the fiber you need from eating a lot of vegetables and greens. Um, what about all the other supplements I take? Should I stop taking those before I get your comprehensive labs done? Not necessarily. You don't need to stop your supplements to get the testing done. That'll give me an idea of what your body's doing with what you're doing with the supplements that you're taking. So as long as you're listing those, I know you'll fill out intake forms and you'll list your supplements there. That's okay. We'll have a good idea if some of your tests are reflective of taking those various supplements. But I'll be honest, it doesn't matter a whole lot because lab findings, these lab tests, it takes a long time for them to really correct when you're taking supplements. But I would rather you'd have to stop a lot of them way sooner. And a lot of you just it's like risk benefit. Should I need to have my appointment, so I need to get my labs done now, because I said to get them as soon as possible. I would prefer you do that. And then we just correlate. That's why I ask in your paperwork to list your supplements. So that's what I would prefer you do is just get your tests. Okay. I'm going to be able to tell you, and I should say, we are going to be able to, whoever evaluates those, um, are going to be able to tell you what's going on. Okay. So rest assured, as long as they're on your paperwork, we'll have the right context. Okay? Been doing this for years and years. Tens of thousands of labs. Help thousands of people. So, okay. I think I'm going to leave it there for you guys tonight. Good session. Thank you for joining me. If you hurt, you need comprehensive testing. Okay? And ladies, remember to have hope. There are answers, and you still have the power to heal. I'll see you very soon. I'll pop in and answer some more questions in the group, and stay tuned for the masterclass for sure when we announce that, so you can plan on attending. All right, ladies, have a great night, and we'll see you real soon.